I welcome all of you in this new medical college, that is Tripura Santiniketan Medical College, and particularly I welcome in this foundation course. You might have been told about foundation course, which gives you the foundation of whole course of MBBS within this short period of time. So only one topic has been selected from pediatrics. Pediatrics, you know, that is a subject which deals with the children, their diseases, their growth, development, everything. So from pediatrics, the topic selected is this one, that is universal precaution and immunization. So there are so many topics, there are at least 150 topics. Why this topic has been selected? Because it is so important. The main mortality and morbidity, that is death and diseases of children, are mostly due to infectious diseases. If we can control the infectious diseases, we can decrease the death of children throughout the country, throughout the world. And not only controlling infection, prevention is also important. So this universal precaution is not only for the patient, this is for yourself also. How we can protect ourselves. Because you will work in the hospital with the patient, that is a source of infections. So along with your academic activities, you have to look after your physique also, your well-being also. So you have to protect yourself. What precaution you will take during your working in the hospital, in the campus, that is also important. So we will discuss slightly about those things also. So in the beginning of your class, I will advise only one thing. That you should be always honest and sincere to your studies, to your day-to-day life. Then you will succeed. This is the main point or advice I give to my children also. Now they all have grown up. They all have become faculties of different medical colleges. But I think I also follow this rule of honesty and sincerity in life. Okay, so our topic is universal precaution and immunization. So what is universal precaution? The measures designed to prevent transmission of diseases, that is from blood and body fluids. This definition is given by Communicable Disease Center of America, which is takes the guiding role in communicable diseases throughout the world. Treat everyone's bodily fluids as if they have potential infections. So in the hospital you will work, you should treat all the body fluids as infectious. So you should be very careful to touch the saliva, to touch the blood, to touch the patient. So what precaution you have to take? You have to take precautions of contact, droplet infection. You have heard of droplet. Droplet infection is through cough. Suppose these germs are going in the air and they are deposited in the tables. So if you touch the table, you may get some infection. So that is droplet infection. And there are some diseases which spreads through the air. Those are called airborne diseases like pneumonias. Now you should always consider the highly infectious thing, blood. So never touch blood of any other persons with bare hand. Semen, vaginal secretion, CSF, synovial fluid, amniotic fluid, and all other body fluids. So all are infectious, may be infectious. Yes, so universal precautions, you have to see bloodborne pathogens can be deadly, be alert and cautious at all times. Treat all body substances as infectious, body substances including blood, oral secretions, feces, urine, wound, drainage, MSCs, that is vomiters, all to be considered as infectious. So to prevent infection to your body, what precaution you will take? Those are number one, wash hands properly, then wear gloves, wear aprons, then wear mask and spectacles. Then you have to dispose all the disposals in proper way. You have to clean the floors properly. You have to clean, after cleaning your hands, you have to wash it with, dry paper, sterile paper, and you have to dispose all the disposals properly. And another important thing during your hospital duty, you should be very aware about prick by needle. That is very dangerous. Many times you will see that house staffs, interns or nurses, trainee nurses, they get injured by needle prick. During injecting a patient, they may get themselves infected by needle prick. So you have to take care of, very careful about this needle prick. Now important precautions, how you will take precautions for infections. Those who have seen the COVID period, in COVID period, if you have seen doctors, most of the doctors used to be in these dresses, completely covered, because it was very deadly disease and it can spread through anywhere. That's why use disposable gloves, mask, cap, eyewear, use protective shoes, use an apron or gown. Here, regarding use protective shoes, this is one important thing you should remember. You should never come to hospital with sandals. Always wear shoes. This is not style. This is for your protection. Because in the hospital area, there are always infections everywhere, particularly in the floors. So you can get infected. That's why never allow anybody to come, any doctor or nurses to come without shoes. Then use an apron or gown. So apron is also very essential to prevent infection. Removing personal protective equipments. You have wear all the protective things. When you remove this, how will you remove? It should be in a sequence. That is, first you have to remove the gloves, then face shield, then mask, then goggles, then your gown, and at last mask. Then there are technique of removing gloves. We are not going into detail. Okay, sorry. So hand washing. This is very important step in the hospital. Not only in the hospital, when you will go after hospital to your hostel to take food, before taking food, you should always properly wash your hands. So hand washing means, in our society actually there are some wrong things going on. When you will go to take attend any function, you will be invited to take food, and usually there is no water to wash the hands. So anyhow we wash hand, and after taking food then we get soap, water, everything in the basins. But ideally it should be before taking food we should wash properly hand. But usually we don't do it. So proper hand washing is very important. How to wash properly. Wet your hands with clean running water. It should be running water, not from one jug where one is pouring, you are washing. Apply soap and rub your hands together for at least 20 seconds. So this is also we don't follow. We just apply soap and immediately wash. At least you should rub for 20 seconds. Rinse your hands until all the soap is gone. Turn off the faucet with a paper towel or your elbow. When you close the tap, you should do it by elbow. That's why actually in washing basin in hospitals there is that faucet is with handle. You can stop it by your elbow. Or if there is nothing, then you can stop it by taking one sterile cloth or paper. You should close that one. And dry your hands with a clean paper towel or hand towel. So this is one very important thing to protect yourself and to protect your patient. Hand washing is very, very important. Now people are saying that in newborn ward, particularly which is we call NICU, neonatal intensive care unit, they say if proper hand washing is maintained, more than 50% death can be controlled by proper hand washing. So it is so important. Now use of needles. Use properly and wear protective gloves. So whenever you will give injection, ideally everybody should wear gloves. But we don't follow it in most of the cases. Dispose properly in thick puncture resistance container. And needle should be disposed in thick container, which is puncture proof. Avoid recapping needles. This is habits you will see many nurses also or those compounders giving injection. After giving injection, they recap the needle. That should not be done because during that time actually most of the cases we get injury. So you don't do it. After giving injection, you will throw it in the container. And use disposable syringes and needles. Nowadays actually everywhere there is disposable syringe. One syringe is not repeated. What you have not seen those days, we have seen in villages those quack doctors. They are just not educated. So they used to give injection like penicillin, toxoid, anything. If anybody used to get injury, they used to go to the quack doctor. He used to give tetanus toxoid. From one glass syringe, that syringe is in front of his table and he is giving at least 15-20 people with same syringe, same needle, just washing in water. So by that I have seen spreading of hepatitis B. Some relatives also died. Ultimately, we could know due to hepatitis B, hepatitis C. They are from villages. So all these things happen due to those type of injections. So it is very dangerous to push injection without properly sterilizing it. That's why now government has given instructions that you have to use disposable syringe, one-time use. You cannot repeat it. After giving injection, you have to throw it out. That is disposable syringes and needles. Now, if you stuck with the needle, so usually this happens commonly. What you will do? Wash injured area with soap and water. Encourage bleeding if any. Wash with soap and water at least for 5 minutes. We try to stop the bleeding. That should not be done in case of needle prick. You should allow the blood to go out because if you push, some of the infection may go inside. So you should not do it. You allow the blood to come for 5 minutes. Wash and report to your supervisor immediately. Then you should take opinion of your senior, what I have to do. They will give advice, particularly prophylaxis to prevent HIV, hepatitis B, viral infection. These are very common due to needle prick. Now, spillage of body fluids or blood. During your ward duty, you will see during giving blood or something, blood fall down in the floor. Sister ask the sweeper, you clean it. he will clean it with the regular mop, which he used to mop every day. It should not be done. If such type of things are fallen on the ground, you have to never wipe with working wet mop. Cover spill with paper and pour 1% hypochlorite or bleaching powder to decontaminate. So these are the actually materials available in ready-made. So after spillage, you should use those things. You have to give 1% hypochlorite or bleaching powder. For few minutes you have to keep it, then you have to wash. So when all the germs will be killed. So these things are important. Now, what are the infection control measures? One is respiratory etiquette, which most of the cases we don't follow. We are sneezing, coughing without covering. So respiratory etiquette: cover, cough or sneeze with tissue, discard and wash hands. So you should keep tissue paper with you. When there is sneezing, you should cover the nose with tissue, and after sneezing, you will throw it out and wash your hand. And if there is no tissue, sneeze in the upper arm. Then you should sneeze like this, keeping your upper hand in front of your nose so that it does not spread to other places. It does not infect other people. And then after sneezing, you should wash your hand. Do not share personal items. Handkerchief. Don't share with other person, because there are maybe infection spread from one person to other person. Then keep your immunization current. You should keep your immunization current means you should be immunized properly. So next we will come to the immunization part. You will know what are the immunizations we should give to ourselves or other people. Now immunization. So this is precaution which you can take, and now this is a precaution. It is also preventive measures, important preventive measures by which we can protect an individual against infection with active or passive process. So immunization is a process by which we can protect an individual by active or passive. Active means we are pushing some antigen, any germs, either live or killed, to body to produce antibody. Antibody will form against antigen. These germs are antigen. When we will push those killed germ or modified germ to the body, there will be production of antibody. That antibody will protect us in future. This is immunization. This is active immunization. And passive immunization is in some diseases, particularly diphtheria, tetanus. Some antibodies are formed in human, non-human bodies, like in horse. One is ADS, anti-diphtheric serum. In case of diphtheria, we have to give immediate antibody, that is anti-diphtheric serum. That is produced in horse, and that is given to human body to protect him from diphtheria. So those are passive process. So now active immunization means administration of all or part of microorganism or a modified product to stimulate immune response, mimicking natural infection without risk to the recipient. That means we can administer whole bacteria or part of the bacteria or modified. Suppose in toxoid, tetanus and diphtheria, we use only the toxoid, that is toxins from the bacteria, not the bacteria. Only the toxins are modified, which is called toxoid, that is given. And in case of passive immunization, protection transferred from another person or animal through antibody. It is temporary and waves with time. Example, Tet-Glop, tetanus globulin, and ADS means anti-diphtheric serum. So if you give it, it will protect you for few hours. So that's why in case of tetanus or diphtheria, we give immediately this Tadlock, and that is passive immunization to protect immediately and give active immunization to protect in future. Active immunization takes time to start function. So during that period, this passive immunization will help us, will protect us. Now there are classification of vaccines. You might have heard name of the many vaccines. Then there are mainly two types of vaccine. One is live vaccine, that is vaccines, germs are alive, but they are modified, purified. And other type vaccine is inactivated vaccine, means killed vaccine. They are not alive, they have been killed by some chemicals, then they have been introduced in our body. So among the live vaccine in viral, there is oral polio, OPV you have heard, oral polio vaccine. Then measles vaccine, mumps vaccine, chickenpox, varicella means chickenpox vaccine. These are all live virus. Bacterial like BCG, oral typhoid. Then in the killed vaccine or inactivated vaccine, whole cell vaccine. That means whole bacteria is used. After killing the bacteria, we are introducing that bacteria as a whole. In IPV, intramuscular polio vaccine, hepatitis A vaccine, rabies vaccine, and pertussis, in bracket WP. What stands WP? Whole cell pertussis. P means pertussis, that is whooping cough. So whole cell pertussis, these are, in these vaccines, whole cell is used. And there are fractional inactivated vaccine, means part of the organism is used as antigen, as vaccine. So there are many types. One is protein-based that is toxoid, tetanus toxoid. So these are toxoid, means they are prepared from the toxins of the bacteria. From the toxin of the tetanus, this vaccine is prepared. Then there are some sub-unit vaccine, meaning part of the virus or bacteria is used, like acellular pertussis. Means acellular means whole cell is not there. Then there are polysaccharide based vaccine. Polysaccharide, what is it? It is not protein. Actually, most of the antigen are protein. But polysaccharide is not protein. It covers, it is present in the capsule of the bacteria. There are some bacteria which have capsule, encapsulated. From their capsule, vaccine is prepared. Not whole bacteria, but only from their capsule, that is polysaccharide. So only when only polysaccharide is used, those type of vaccine are called pure vaccine, pure polysaccharide vaccine, like typhoid, pneumovax, pneumonia. And conjugate, that polysaccharide is conjugated with some other protein from other bacteria. So in that case, you get more response, immunity. Those vaccines are HEP, that is Haemophilus influenza B, pneumococcal vaccine 13, typhoid conjugate vaccine. So these are the various type of vaccines you will come to know during your classes. Oh, sorry. Now, this universal immunization program. Now, Government of India has introduced this universal immunization program. This program is going on since 1985. Previously, it was called EPI, Expanded Program of Immunization. In 1978, immunization program started. That means government has started giving vaccines from government side. Before 78, there is no vaccination from government side. If anybody was interested, he could purchase and give it. But from 78, government has started to give 6 vaccines. That was called Expanded Program of Immunization. In that program, there was DPT, diphtheria, pertussis, tetanus, polio, measles, and typhoid was there. But in 85, no, measles was not there, typhoid was there. In 85, instead of typhoid, the government has introduced measles. oral polio and DPT. And from 85 onwards, government has started to introduce more vaccines in the immunization schedule. Now at least we are giving 10 to 12 vaccines from government side. So this is called universal immunization program, means every children will get it free of cost, and it will be given by health workers. At primary health center, even sub-center, they are giving. So what are the vaccines? These vaccines are given in a scheduled manner. Suppose at birth some vaccines are given, some vaccines are given at 6 weeks, some 10 weeks. So that is fixed schedule by Government of India. So according to that schedule, we give at birth 3 vaccines. After birth, you will get your relatives having delivery in some hospital or nursing home. They will now start asking you what vaccines you should get or those things. So you have to know it. Though you will learn it from your classes only in 3rd year or 4th year. But these are so essential things you have to know from the very beginning. So at birth, oral polio is given, hepatitis B birth dose. Oral polio vaccine, OPV 0. 0 means 0 dose, means at birth. So hepatitis B and BCG. BCG is what? Against which disease? Tuberculosis. Bacilli calmette guerin is the name of the organism. That's why it is written BCG. So these vaccines are given at birth. Usually within 24 hours it is given in the hospital. Then at 6 weeks, 10 weeks and 14 weeks, oral polio is given pentavalent injection. Pentavalent. What is pentavalent mean? Penta means 5. In one injection you are giving vaccine against 5 diseases. What are those? You see diphtheria, pertussis, tetanus, hepatitis B and Hib. Hib means Haemophilus influenzae B. That is a bacteria. So against these 5 you are giving in one vaccine, that is pentavalent. So this pentavalent and oral polio is given at 6 weeks, 10 weeks and 14 weeks. Same injection. And fractional IPV, that is inactivated polio vaccine. Oral polio vaccine we can give in 2 forms. One is orally, other one is injectable. So now it has been seen oral polio vaccine cannot prevent polio. That's why, though we have already eradicated in India. In 2011 there was the last case of polio, but our neighboring countries like Afghanistan, Pakistan and some countries in the Africa, they are still having polio. As because they are still having polio, there is every chance to transmit it to our country also. That's why we are giving both IPV and OPV. IPV means intravascular polio to all of our children, and this is called fractional IPV. Fractional IPV means actually this IPV, that is inactivated polio vaccine, usually given intramuscular, but that dose is 0.5. But it is costly. That's why government is taken one policy that not giving intramuscular. If we give subcutaneous or intradermal, then 1/5 dose is sufficient. That's why it is called fractional IPV. Instead of giving intramuscular polio, they are giving intradermal, so only 0.1 ml is sufficient. Then another vaccine is rotavirus. Have you heard of it? This rotavirus, what it causes? It causes diarrhea. Around 30 to 35% diarrhea of our country is due to rotavirus. So we are giving rotavirus vaccine at 6 weeks, 10 weeks and 14 weeks. Then pneumococcal conjugate vaccine, PCV. This vaccine we are giving, government is giving at 6 weeks and 14 weeks and 1 dose at 9 months. Then measles and rubella. This is measles and rubella. Rubella, this vaccine is called MR vaccine. M for measles, R means rubella. That is given at 9 months. Then Japanese encephalitis vaccine. This also occurs in our Japanese encephalitis is not prevalent in all the states of our country. In some states it is prevalent, that's why in those states it is given where it is prevalent, like Tripura, Assam, in Bangladesh also it is very much prevalent, West Bengal, then some South Indian countries, then Bihar and UP. These are the countries where, states where Japanese encephalitis are prevalent. So in these states, this Japanese encephalitis is also given by government at 9 months, and another dose will come later on. And vitamin A dose. Vitamin A, it is not an antigen, but it is so important, and it is given by around the immunization team. They are giving vitamin A at 9 months, then every 6 months. Sorry. Then DPT booster at 16 to 24 months we give DPT booster. DPT means diphtheria, pertussis and tetanus. Then MR vaccine second dose is given between 16 to 24 months. OPV, oral polio vaccine booster, 16 to 24 months. Japanese encephalitis second dose given 16 to 24 months. Then vitamin A second to 9th dose at 16th month, then 1 dose every 6 months. Then at 5 to 6 years we give DPT booster second booster. First booster we gave at 16 to 24 months, second booster at 5 to 6 years. Then you should give TD. And these vaccine, I don't know whether you have received at 16 years, 10 years and 16 years. Everybody should receive. But in most of the cases, nobody takes this one, 16 years. After 10 years, everybody forget to take any vaccine, they think they become adult. Parents are also not very much worried, so they are left. So those who have not taken this vaccine, you should get it from hospitals. So this is Government of India's chart, immunization chart. There is another chart, I am not going into that, you will learn it later on. In that chart, there are some other vaccines like typhoid, like chicken pox is not included in this vaccine. Government is not giving free of cost these vaccines. But these vaccines are available in the market. So those who want to protect their children against those diseases, they can give it. So for those diseases and these all vaccines, IAP, Indian Academy of Pediatrics, that is our association, academic association of child specialists throughout the country, they have chart out one immunization schedule. They are typhoid, chicken pox, influenza, all these vaccines are included. So we are not discussing that one. Yes. Now there are newer emerging vaccines. Some vaccines will come, you will get, might be in 1, 2 years, 3 years time. One is malaria vaccine, dengue vaccine, HIV vaccine, hepatitis E vaccine. Studies are going on. We may get these vaccines in future. Now, this is one important thing in immunization. After immunization, there may be some reactions. You might have seen after giving injection to small children, they develop fever, pain, swelling at the site of injection. All these are called adverse reactions, adverse events following immunization. And there are some reactions which are very severe, which is we call anaphylaxis. Even patient may die. Their incidents happened after giving injection within 10-15 minutes, patient died. So that is due to anaphylaxis. So you have to be concerned about this, you have to know what can happen. And there are some reactions which are not at all associated with vaccine, but because it has occurred immediately or within 10 or 15 days of giving vaccine, it is also included in the adverse event following immunization or AEFI. And as a medical officer, you have to report it. If anybody complains that after giving injection, I have developed this thing, then you have to report it to the government. So what is an adverse event following immunization or vaccine associated adverse event is defined as an untoward event following immunization that might or might not be caused by the vaccine or the immunization process. Suppose patient has complained that patient after giving injection yesterday, patient developed fever and convulsion today. This might not be due to this vaccine, but you cannot refuse that, no, this is not due to my vaccine. You have to report it to the government and they will analyze. If necessary, there may be, I told you, there may be death also. So whether it is due to vaccine or due to other cause, we have seen many cases and we have to go to many places, interior places also to inspect or verify what was the reason of death. In small children, in Teleamura, we went a few years back, there was a death after vaccination at Teleamura, patient died second day or third day, but there we found it was due to pneumonia. Patient actually had pneumonia, mother did not know. Patient get injection and after 2-3 days, patient suffered fever and died. So ultimately doing postmortem and everything, report came, it is due to pneumonia. But you have to include in the adverse event following immunization, all these things. It is not working. So one thing, if there is anaphylaxis, what I told, if after giving injection, vaccine, or there are some medicine like penicillin injection, if you give penicillin injection without testing, patient may die immediately due to anaphylaxis reaction. That is a reaction. So anaphylaxis, if happens, suddenly patient will fall down, you will not get blood pressure, you will get that patient is in shock. So if immediately you cannot treat, patient will die. So for that reason, in immunization center, always there should be injection adrenaline or epinephrine, which if you give immediately intramuscularly, patient will survive. And if you cannot give, patient will die. So this is a very emergency thing and everybody should know how to give 0.01 ml per kg per dose IM in anterolateral thigh. So this is to remember that in anaphylaxis, we have to give adrenaline injection. Now guidelines for safe immunization practice. This is also you have to remember. As a medical officer, you should remember that keep all the vaccines at proper temperature. Another important thing regarding vaccine. Somebody may complain that, doctor, I get all the vaccines of typhoid, but my child is having typhoid. So one of the cause may be that vaccine was not proper. If all vaccines are not kept in proper temperature, the quality of the vaccines deteriorate. And some vaccines, like polio vaccine, if you keep it outside for 6 hours, suppose you have kept in freeze was not working for 6 hours, that vaccine will be should be discarded. That will not be effective at all. So this is important, how to take care of these vaccines. All UIP vaccines, means universal immunization vaccines, should contain VVM. VVM means vaccine vial monitor level, and check it and expiry date before use. This is another important thing. In every vial of vaccines, it is written what is the manufacture date and what is the expiry date. But due to some busyness or negligence, somebody gives vaccine and after all they found that it is expired date. Then you will be blamed, you will be fined like rupees lakhs or something like that for doing this, that you have given expired vaccine. So you have to look for that. Then use correct diluents for the constitution of vaccine. There are some vaccines which are available in powder form, and diluent liquid is also given with it. Like BCG, measles, these vaccines are available in powder form. So each diluent for BCG and measles is separate, for MMR is separate. So you have to add those diluent with that particular vaccine, not that BCG's diluent you have added with measles. Then there may be some reaction. So this should not be happen. There are occurrence of by mistake and in the vaccine carrier or in the refrigerator where you are keeping the vaccines, it should not contain anything else vaccine. In one center it happened, doctor used to take insulin. So he kept insulin vial in this vaccine vial. When he ordered his sister, working sister, nurse, that you prepare the BCG vaccine and give it to me to give injection to this baby. She gave insulin, she added insulin with the vaccine powder. After giving the patient, immediately patient died. So this thing should not happen. That's why it is told that in your refrigerator you should not keep anything else vaccines. This is very important. And use BCG and measles vaccine within 4 hours of reconstitution. We have told that this comes in the form of granules. You have to add water, diluent, and then give injection. And one important thing is, these vaccines which are prepared with adding diluent, they should be used within 4 hours. That's why in the vial, it is the rule that you have to write at what time you have prepared it. You will see in the immunization center, sister write 10:30. Means it is prepared at 10:30, so you have to use it within 4 hours. After 4 hours, you have to discard it. Otherwise, there may be severe reaction, severe diarrhea. Those things can happen due to infection. After 4 years, some organism may develop there and may cause diarrhea, vomiting, etc. So that's why it is not used. And one beneficiary, one syringe, one needle must be followed. That is disposable syringe. So always it should be given by disposable syringe. Now cold chain. What we told, these vaccines should be kept in proper temperature. If you do not maintain temperature, it will be ineffective. So what are those? What is cold chain? System of transporting, storing, distributing and administering vaccine in a potent state at the recommended temperature from point of manufacturer to point of use. So it is produced in some factories. From that factories it comes to our place by air, by train, by bus, by lorries. But during that transport, it should be properly maintained temperature. In proper carrier, it should be kept. And safe zone for short-term storage is 2 to 8 degrees centigrade. That's why during storage or during transporting, the temperature of the vaccine carrier should be 2 to 8 degrees. So it is very important. If it is 15 or 20, if you bring some vaccines without giving ice cold or those things, preparations, then it will damage. Then equipment for cold chain maintenance are refrigerator or ILR, that is ice-line refrigerator, vaccine carrier. And temperature monitoring device in freezers where you are keeping the vaccines, temperature monitoring should be there. It should show that temperature, what temperature it is. You can ask, don't think that I don't know. Yes. TD vaccine. Yeah, TD. TD is tetanus and diphtheria. It is given at 10 years and 16 years. But if anybody has not taken 16 years, he or she can take it at 20 years, 21 years. And even after 16 years, though it is not written here, anybody should take TD vaccine every 10 years. But there is a wrong notion in villages or even some subdivisions also. They take tetanus toxoid vaccine or TD vaccine after any injury. It is not required. If you are properly vaccinated, after 16 years, next 10 years you should not give any vaccine. If you get injured also, you need not give any vaccine. Then at 26 years, you can give another vaccine, then you will be protected for another 10 years. So after 10 years, you can give vaccine. So this is the procedures how you should keep your vaccines in your refrigerator. So you see, this is ice cubes, this is the freezer section. You have seen there may be two door or single door. Here it is single door refrigerator. In the upper one there is ice cubes, and here you have to keep the OPV vials. They are the most vulnerable vaccine. So you have to keep it near ice in the first chamber, that is deep in the refrigerator. OPV vials freezing compartment. Then measles and BCG. These are our second two oral polio vaccine vulnerable. That's why in the next chamber you have to keep BCG and measles. Then you can give in these two other all vaccines, and lower one is for diluent. And don't keep anything in the door. And this is the dial thermometer, which will indicate what is the temperature of the freeze at the time. So this is properly, so this top, middle and lower, it should contain only diluent. Nothing else. In some places, in my clinic also, my attendants, they sometimes keep their water here. I don't allow, but they try to keep during summer season, they try to keep in the door their water. It should not be kept. Anything should not, ideally it should not be kept. So this is vaccine vial monitor. This is a vial. So you see, this is a vial, polio vaccine or any vaccine. So here this is called vaccine vial monitor. In the vial there will be a circle, and inside the circle there is a quadrangle. So when this vaccine will come in contact with heat, there will be change in the color. This central portion will become darker. When it will be as dark as the outer segment, that means it is spoiled, it is not working, it should be discarded, it should not be used. That's why it is called vaccine vial monitor. If it depends and color becomes color of the outside layer, then it should be discarded. That's why it is called vaccine vial monitor. So you need not be worried whether freeze was on, whether current was there or not. You just, before giving injection, you should see whether the color is lighter than the outer color. This should be always lighter than the outer side. That means your vaccine is working. Contraindication of immunization. This is another important thing. Anaphylaxis following a previous dose or known allergic reaction to vaccine component, you should not give. And encephalopathy within 7 doses of pertussis vaccine. Pertussis, that is whooping cough vaccine. If you give pertussis, that is now pentavalent vaccine, what is government giving. If after that vaccine patient develops encephalopathy, you should not repeat the second or third dose of that vaccine. For some live vaccines, immunosuppressed state. In some diseases like cancer, leukemia, AIDS, that is autoimmune diseases, there is less immunity. In that case, you should not give live vaccine. Live vaccine can do harm. So this thing you have to remember. So this is to remember that you can give vaccines, you should not give to one site more than one vaccine. But at a time you can give vaccine in different sites. So this is a 9-month-old child who had not received any vaccine previously. So we can give him all vaccines, hepatitis B, DPT. Now it is available in same vial. It was a old chart. BCG vaccine, vitamin A, oral polio vaccine. All vaccines you can give at a time. But after that, second dose of vaccine should be given at least 4 weeks after the first dose. In between you cannot give. Suppose some mother tell us, doctor, I will give 1 or 2 injection today and another injection after 2 days or 3 days or 7 days. So this should not be allowed. No, you have to give either today or after 4 weeks. That is 28 days. So this is in nutshell about immunization. Thank you. So yes, if you have any question, you can ask. Any other question? Yes. Are you vaccinated against hepatitis B? You don't know. You should keep your vaccination card. If it is available, you should see what vaccines you have taken, what vaccines you have not taken. You should take now. Many of you might not have taken hepatitis B vaccine, you can take it. Many of you might not have taken TD vaccine, you can take it. And there are some vaccines available. Previously, you used to not to know that about those like hepatitis A, which is very common among the medical students. We have seen because of you are coming from a healthier home atmosphere to a hostel life where you may not get proper water. So due to water contamination, you may get hepatitis A disease. We have seen many medical students in different colleges, hostels, used to suffer from hepatitis A. Even death of some students occurred due to hepatitis A disease. So those vaccines, you can, those not taken, you can take it now for future protection. And vaccination is not for only children. Now vaccination in many countries, vaccination is given in old age also. And you know, some people say that old and newborn, they are similar in some characters. Regarding immunization or immunity, at old age, immunity decreases. So they are very vulnerable for infection. That's why particularly influenza, pneumonia, these 2 diseases and chickenpox. These diseases are very common in old age. That's why you might have heard from your grandma or grandfather that I don't know whether this winter I will survive or not. Why they are afraid of winter? Because during winter there is more pneumonias. So if they get one pneumonia vaccine at 60 or 65 years, they will be protected. If they are, for influenza vaccine, actually it has to be given yearly. So these vaccines are not given through government facilities. It has to be given. And in adolescent, there is adolescent vaccination also, immunization. Many adolescents have not taken vaccine after 10 years or 8 years. So they can also take all the vaccines. There is schedule also for adolescent up to 19 years what vaccine they can take. So vaccination is not for children, it is for adult also and for older people also. Okay, thank you.